Hello everyone. Today I'm going to talk about feeding challenges in autistic children. Food is necessary for life. It provides the fuel needed to run our body functions and is important for the growth and repair of our body cells and overall health. Eating is one of the ways our body accesses food to help us grow. For some people, eating is a pleasurable act and it's easy to do. But for others, eating can be difficult and scary. Today I will speak with Mr. Harris, who has concerns about his son Adam, who is a 3-year-old boy recently diagnosed with autism spectrum disorder. Hi Mr. Harris, how are you doing today? How is Adam?
Hi, Dr. Smile. I'm doing well. I need help with Adam's feeding. He only eats crackers and chicken nuggets. I cannot get him to eat normal foods. He doesn't eat vegetables. It's hard getting him to sit at the table. My wife and I have different ways of managing this. We argue a lot, and sometimes I feel like just holding him down and feeding him. I just want Adam to eat dinner with us.
I understand, Mr. Harris. As a parent, I know it's hard to watch your child struggle to eat. Adam has feeding challenges. This is when a child is unable to or avoids eating or limits what or how much they eat. This is also associated with challenging meal times. This is a common presentation in autism spectrum disorder, as autistic children are 5 times more likely to have feeding challenges than a child without a diagnosis of autism spectrum disorder. Like Adam, many autistic children prefer to eat carbohydrates and processed foods, like French fries, chicken nuggets, cookies, and crackers. Like Adam, some autistic children experience difficulty eating fruits and vegetables. When a child has feeding challenges, this may have a negative impact on family life. Sometimes parents or caregivers have to change daily routines to accommodate the child's mealtime preference. There's sometimes increased parental stress and strained relationships with other family members due to the concerns around the child's eating behaviors.
But Dr. Smile, I'm a good cook. I make baked salmon, barbecue chicken, rice and peas, salads, roti, pasta. Adam looks at it and walks away. Then I see Adam looking for his box of crackers. He sits there and looks at each cracker to make sure it is not broken before eating it. Even if I try to hide a veggie treat in his cracker, he spots it and that's the end of that. He stops eating and holds the cracker in his mouth.
I understand, Mr. Harris. Many autistic children may limit or avoid foods based on either its color, texture, smell, taste, temperature, shape, or how it looks. Feeding challenges may also present as unusual eating behaviors, such as holding food in their mouth, like what Adam does, or gagging or vomiting on seeing certain foods, compulsive eating of certain foods, eating non-food items such as sand, dirt, paper, and regurgitation of food in their mouth. Mr. Harris, does Adam cough, chokes, or drools while eating?
No, he doesn't. Why do you ask?
A child who has a swallowing difficulty may cough, choke, or drool while eating.
Okay. No, Adam doesn't do that. Dr. Smile, Adam was not like this as a baby. He breastfed on both breasts. My wife couldn't get him off. He ate rice, chicken, beans, cauliflower, anything you put on his plate, he ate it. Then he just stopped eating regular food.
Mr. Harris, that is not uncommon. Feeding challenges can emerge in the first 2 years of life. Some kids will gradually stop eating foods that they previously ate, or other kids have difficulty transitioning to solid foods.
Oh, okay.
And adding a new food is often met with resistance.
So why does this happen? Did his autism cause this? Did I do something wrong? What do I have to do? Learn to bake crackers? If that's what I have to do, I'll do it.
There's nothing you did that caused this, Mr. Harris. There are many factors that contribute to feeding challenges in autistic children. insistence on sameness, inflexibility, and differences in sensory perception related to smell, taste, texture, and how the food looks seems to drive feeding challenges in autism spectrum disorder.
I see.
There are medical factors as well to consider. First, we need to ensure that Adam has the proper skills needed for feeding. One of the skills that we look at is his oral motor skills. Children with delayed oral motor skills may be unable to chew and swallow foods of certain textures, leading to food refusal. Other common medical factors that we look out for are dental caries, food allergies, gastroesophageal reflux, and constipation.
Okay, Adam only eats crackers and chicken nuggets. He can't be getting enough vitamins or nutrients to help him grow. I'm concerned about this. What should I do? What should I look for?
To answer that question, let us look close at the foods we eat. Food provides our bodies with micronutrients, things that we need in small amounts, vitamins and minerals, and macronutrients, things that we need in larger amounts like fats, carbohydrates, and proteins. These nutrients help with cell growth, cell repair, cell maintenance, and the overall health of our body. Studies have shown that autistic children may have low levels of calcium and protein. Mr. Harris, you're right. Inadequate food intake may lead to insufficient levels of important nutrients. Things that we look out for will be like vitamin A. This is important for vision, for growth and immunity. And vitamin A deficiency can cause anemia and dry eyes and potentially loss of vision in severe deficiencies. Vitamin C. This is important for building our blood vessels, cartilage, muscles, collagen, and helps our bodies heal. Severe vitamin C deficiency can lead to a disease called scurvy, which causes anemia, bleeding gums, bruising, and poor wound healing. Vitamin D. This is important for bone growth and health. A deficiency in vitamin D makes it harder to maintain calcium and phosphorus levels in bone. This can affect bone development, making bones softer and weaker. We call this rickets. This presents with bone pain, muscle weakness, delayed motor skills, skeletal deformities such as bow legs or knock knees. And lastly, iron. This is important for the production of hemoglobin in red blood cells that helps to carry oxygen around the bodies to all our cells. Iron deficiency can present with tiredness, paleness, and shortness of breath.
Dr. Smile, Adam looks healthy. I don't think he has any deficiencies. Even though Adam eats only crackers, he is gaining weight.
Mr. Harris, sometimes it's hard to tell if a child's food intake is adequate just by looking. Many autistic children with feeding challenges may have normal weight. Some may be obese and others underweight. Measuring Adam's weight and height can help us to determine his nutritional status. However, a child can still have a nutritional deficiency even when their weight and height are within the normal range. Doing blood investigations to rule out nutritional deficiencies is sometimes necessary.
So what do I do now? I've tried to hide foods. That didn't work. I don't want to admit it, but I did force feed Adam once. I didn't like how that felt. So I need you to help me with this.
Mr. Harris, don't despair. There are a few things we can do. Remember, never force feed a child. First, we'll take a log of Adam's oral intake over a 24-hour period or 3-day period. We'll review it together. I'll then complete a medical history and a physical examination on Adam. Having a feeding assessment will help to determine the right healthcare professional needed to address Adam's feeding challenges. Depending on our discussion, I may refer you to see another healthcare professional. This might be a dietitian, speech and language pathologist, occupational therapist, or behavior consultant. Together, we will find out what factors are driving Adam's feeding challenges and create a treatment plan.
That sounds like a plan. Thanks, Dr. Smile. Adam is my life. I love him. I just want Adam to eat.
I understand, Mr. Harris. We'll work on this together.
Thank you.
Parents, you're never alone. If your child is having feeding challenges, speak with your healthcare professional. Working together, we can help with improving your child's feeding. Thanks for watching.